So risk factors, name me 3 or 4, and then we'll talk about them individually.
Sure. So some of the important ones are high blood pressure, high cholesterol, diabetes, and smoking.
So let's go to high blood pressure. What is a normal blood pressure? I'm shocked that people don't know what their blood pressure is. What's normal?
Well, normal or ideal blood pressure is actually less than 120/80.
So 120/80 is the golden standard. What level do you have to get to be in danger of a stroke? Is there any number?
Not a particular number, but if the blood pressure is consistently more than 140 millimeters of mercury, for example, then that would be high blood pressure, would typically be treated with medication.
So what does that high blood pressure do to the blood vessels that would cause a stroke? What would it do?
It really causes long-term damage to the surface of the blood vessel called the endothelium.
And that damage can lead to blockage. 2 kinds of stroke. What are the 2 kinds of strokes?
There are ischemic strokes, which is lack of blood flow to the brain, and then hemorrhagic strokes, which is a bleeding stroke in the brain.
Can high blood pressure cause both of those?
Actually, it can. It's a risk factor for both ischemic strokes and hemorrhagic strokes.
So you mentioned another risk factor, high cholesterol.
Yes.
Tell me about cholesterol and what we can do about it to help our cholesterol levels to avoid or prevent strokes.
Right, so cholesterol is one of the major risk factors for plaque buildup, and plaque buildup can cause blockage in the carotid arteries leading to the brain or the blood vessels within the brain.
So if the hardening of the arteries gets too bad, you can have an ischemic stroke or a hemorrhagic.
Mostly an ischemic stroke, so high cholesterol goes along with plaque buildup and ischemic strokes.
So it blocks the artery. The brain, does it need a lot of oxygen?
It does.
You know, it needs more oxygen than any other organ. So if you take that oxygen away, you've got some problems.
That's right.
So what cholesterol levels are we looking for, and how do we get good cholesterol?
So we like to see total cholesterol ideally less than 150. And the good and the bad cholesterol, the LDL is the bad cholesterol. We like to see it low, under 100 or even under 70. And the HDL, the good cholesterol, we like to get that up.
So if people know their values and they don't meet those values, what can we do to lower our cholesterol?
So improve the diet, improve exercise, lose weight. But many people need cholesterol medication. And we have very effective medications like statin drugs that lower cholesterol.
When we use statin drugs, do you have to build up the dose? Do people have muscle cramps, muscle aches, problems that say, I can't tolerate this?
They can. Most people can take statins and they do not have any side effects, most people. But there are a percentage of people that get muscle aches in particular and they cannot tolerate statins, and we have to look at some alternatives.
So now we've got high blood pressure, we've got cholesterol, we've got both those under control. How about diabetes? How common is that? And how does it cause problems that can cause stroke?
Well, it has become more and more common. We really have an epidemic of diabetes in our part of the country and in the United States. So more than 1/3 of people now are developing diabetes in the population. And it relates to plaque buildup. It relates to stroke within the brain as well as plaque buildup in the carotid arteries.
So I can remember one time a guest saying, if you have an elevated blood sugar, if you have the diagnosis of diabetes, it's a wake-up call for your heart, because it's time to get really serious about your cholesterol, about your blood pressure, and about your diabetes. So what do you do about the diabetes, especially if it's type 2?
So you're right. So we call it a heart disease equivalent. And it's very important to change lifestyle, to eat better, get the weight down, especially with type 2 diabetes, which in adults, and also to control the blood sugar.
Smoking?
Smoking is a powerful risk factor for stroke and can be modified by quitting smoking.
People have a difficult time stopping smoking. What do you tell them? If somebody's smoking, you know the dangers, you know what's in store for that patient. How do you get them to stop smoking?
Well, I always encourage them. I never quit trying, and I tell them to never quit trying. And we talk about a variety of strategies and techniques to quit smoking, but we just have to keep after it.
And I think that's so important. It's not just one time stop your smoking, it's over and over.
That's right.
And over. And there's lots of things that people can do to stop that. So how about being overweight, obesity, sedentary lifestyle? What does that mean, sedentary lifestyle?
That means not exercising. So being a couch potato. We'd like to see people exercising almost every day. You know, ideally 6 days a week. You get 1 day of rest, but otherwise keep exercising.
So we've gone through risk factors. If we follow those, if we keep our blood pressure good, if we keep our cholesterol where it should be, if we stop smoking, if we get our diabetes under control and get more active, think it really cuts down on the incidence of strokes?
It does, considerably.